Thank you for all joining us today. I'm Michelle Steele, Chairman of the Orange County Board of Supervisors. Today, the Orange County Healthcare Agency reported 100 new cases of COVID-19 and 6 new deaths. This brings out our total to 5,744 confirmed cases of COVID-19 and 142 deaths to date. Our hearts goes out to the families of those who have been lost. Additionally, 1,229 tests were conducted today countywide, bringing our total number of those tested to 112,004. Our healthcare agency as well as private labs are rapidly increasing the number of tests here in Orange County so that we can get a more accurate representation of the rate of spread for the virus. More information may be found on HCA Healthcare Agency's website at ochealthinfo.com/COVID-test. Orange County is blessed to have amazing healthcare workers and top-notch medical facilities to be treating this virus. As of today, we have 255 hospitalizations and 105 in ICU. It is my hope these patients will recover soon. I'd like to point out that since last week's press conference, the healthcare agency has begun posting recovery rates. I want to remind you that this is an estimation, not an exact number of recoveries. As of today, Orange County has 2,209 recoveries. This is great news as 38% of the total confirmed cases to date have recovered, telling us that Orange County is well on its way to getting out of this situation. We still have a lot to do, but Orange County is in good position. And we have reason to be positive about where we are. I'd like to address the fact that in comparison to all our neighboring counties and the state as a whole, Orange County has the lowest rate of confirmed cases and the lowest rate of COVID-19 related deaths. Overall, COVID-19 positive test percentages are at 5.1% and has decreased from 6.3% 2 weeks ago. Orange County is testing more. A decreasing positive test percentage is a good sign. The dine-in restaurants and walk-in stores opened last Saturday in Orange County. On Tuesday, barber shops and hair salons opened their door for businesses. While Orange County opens all these businesses, we ask Orange County residents to keep in mind our safety precautions so that the health of those in our community is protected. Before I address the actions that were taken by the board on Tuesday, I want to speak about something that occurred during the board meeting. At Tuesday's Board of Supervisors meeting, we heard from many constituents that are upset with the recent facial coverings order implemented by our county health officer, Dr. Nicole Quick. Many expressed their desire to see it amended or repealed. Unfortunately, during the public comments, Dr. Quick received a death threat. While many people have strong emotions related to the facial coverings order, it is never appropriate to intimidate or threaten violence, particularly with our public health director. As a chairwoman of the Orange County Board of Supervisors, it is my job to ensure the public safety of our residents. This includes our hardworking staff at the healthcare agency. Regardless of any differences of opinion, no one deserves to be threatened or intimidated in the way that Dr. Nicole Quick has been. She has been a hardworking partner in this crisis. I strongly condemn this behavior, and it should never happen again. At Tuesday's board meeting, the board joined me in unanimously supporting a resolution that declares all houses of worship as essential in Orange County. A large number of Orange County residents rely on their houses of worship for spiritual guidance in their lives and communion with those that share their faith. Religious institutions are often used as a safe haven for those in tough situations at home. This resolution will help those who need a safe place and extra support from those in their community. Additionally, the board also yesterday voted to allocate $75 million of CARES Act funding to small businesses across Orange County. While I would have preferred the funds go directly to cities to be distributed to their business communities, the board voted to split the funds by the districts, with each district receiving $15 million each. Of the $15 million allocated to my district, I will distribute these funds to each city based on population size. It's no secret that our businesses have been struggling, and I intend to get this emergency money to the cities in my district within the next few days. Time is of the essence, and ensuring this money goes straight to businesses without bureaucracy getting in the way is of the utmost importance. This money needs to get to these struggling businesses as soon as possible. Finally, the economic toll the coronavirus has taken in Orange County and the state of California has been nothing less than disastrous. Our state has seen over 4 million unemployed and a $54.3 billion deficit in the state. Families are struggling. People are out of work. We've done our best to help the taxpayers of Orange County during this time, and I believe this week's announcements are a step in the right direction. As we continue doing everything we can to help families to get back on their feet, I am pleased to announce today there will be no new tax or fee increases in next year's budget for Orange County. The last thing our residents need in the midst of this crisis is more taxes and more fees. Today's press conference will have Dr. Clayton Chow, Director of Healthcare Agency, and our CEO, Frank Kim, who will be available to answer any questions. And thanks for joining us today. And Dr. Chow, it's your turn.
Thank you so much, Chairwoman Steele, for your words of support for the hardworking staff and the unfortunate incident that happened this last Tuesday. As the director for the healthcare agency, I also would like to repeat that I would not tolerate such behavior. Good afternoon. My name is Dr. Clayton Chow, Director of the Orange County Healthcare Agency. I would like to provide an update on the business reopening in Orange County. We have received some questions from local businesses and community members about the state reopening guidelines that I hope to answer today. The state's COVID-19 reopening guidance for specific industries should be followed. Details are also available on our website at ochealthinfo.com/novel coronavirus. So here's the update for businesses activity that can open. Counties that have been graded a variant by the state, like Orange County, can open hair salons, barbershops. It's important to note that all parties must wear face coverings and personal protective equipment. No procedures or services that require touching the face are allowed. Church services, funerals, cultural services, and protests can resume. These activities must be limited to less than 100 participants if they are taking place outside. If they are taking place inside, they must be limited to 100 participants or 25% of the facility's capacity, whichever number is lower. Update on business that cannot open at this time: nail salons or spas, gym and sport clubs, gymnastic, dance, and ballet studios, Little League and all other sports camps, private and public schools. College courses must follow distant learning protocols regardless of lab requirements. Public pools, even in private neighborhoods. And public pool means if you ever need a permit from the environmental health science, then your pool is categorized as a public pool. Weddings with groups are not allowed yet. Private gatherings in a person's home are limited to those in the same household. Business webinars. So we know there's a lot of question from the business owners. So the healthcare agency, in partnership with the Orange County Business Council, is pleased to host 3 Zoom webinars for our business community. Title: Are You Ready to Reopen? So the first one will take place today at 3:30. In fact, that's why I have to run right after this to get ready for that webinar. And today's webinar will be for retail business. The second will be Friday, tomorrow at 3:30 p.m. for restaurants. And the third one will be Saturday at 3:30 p.m. for other business sectors. Interested businesses can RSVP to E-Team, that is ETEAM, at ochca.com for meeting information. Let me repeat the RSVP email address again. Is E-Team at ochca.com. Now I would like to invite my boss, CEO Frank Kim, for the question and answer portion of this press conference. Thank you.
Good afternoon. I'm Frank Kim, the County Executive Officer. Moderator, do we have questions from the media?
Our first question comes from the line of Nick Gerda from the Voice of OC. Please go ahead.
Hi, Frank. Can you hear me okay?
I can.
Excellent. Yeah, thank you guys for taking questions again. I had a question for Frank on the county workforce. I understand in some departments, half or more of the staff have been working from home. So curious where the county is at in bringing people back to work, if you have numbers on that. What kinds of safety measures are being put in place to protect workers and the public as people return back potentially to their county jobs? Will the county be following the Cal OSHA safety guidelines? And have you given guidance to all departments on this, or are you generally leaving it to each department head?
Thank you for that question. So the county is a business like any other in Orange County, and we're following the guidelines from the state and our local health official. So to answer your question, I think it's not a simple answer, because we have 17,000 employees distributed over dozens and dozens of different sites. So we're doing what most businesses in Orange County are doing, where we have public counters. We're putting in the plexiglass, and that will be done, I think, in the first week or so in June. So once that is complete, then you'll see us begin to phase in the opening of those public counters. So I expect that to occur within the mid-June to end of June timeframe. That's consistent with what I hear from my counterparts in other large urban counties. In terms of businesses and departments, they're all a little different, right? So if you're at John Wayne Airport, that facility is continuing to operate, and you may have some administrative staff that are telecommuting, and they're able to maintain their productivity doing so. So long as they can remain productive, I've encouraged my department heads to continue telecommuting. We have set up a strike team of our human resources group, our risk management group, and our facilities group. And the three of them have come together and established a checklist for each of the facilities that we have county employees in. So department heads are required to go through and check off all of the requirements in the facilities guideline. And once they have met that need, then it's up to each department head to start phasing in their employees appropriately and again, where they're able to continue to productively encourage employees to telecommute. So I think the answer to your question is, of course, we will meet any Cal OSHA requirements. That is a requirement. We will look at the California Department of Public Health because we take guidance from them. We will speak to our health official, and we will follow our checklist that we developed internally. So we're going through that process right now, and what you'll see is essentially a phased reopening of county government. Next question, please.
Great.
Our next question comes from Paul Anderson from City News Services. Please go ahead.
Hi. San Diego County is going to be allowing passive use of the beaches. Wondered if Orange County is going to follow suit soon as well, or if you've been in touch with the state on that.
Can you repeat your question? I didn't hear the first part of that.
San Diego County is going to be allowing passive uses on the beach, like sunbathing, and wondered if Orange County has been in touch with the state and is also to follow suit soon as well.
Thank you for that question. So we are in contact with the state regularly in terms of how they're managing their beaches. As you know, in Orange County, I believe the greatest proportion of our beach frontage is operated by the state, Bolsa Chica and other state beaches. So we are in regular contact with them. Our understanding is the state is going to open up all of their parking, and we are following suit. And starting next week, all of our parking lots will be open as well. We're also in communications with local cities to ensure that our beach practices mirror those within the communities that we are a part of. So I think your question is, are we moving forward with passive use? That is something that I have not spoken to my staff about, but I suspect that they're already working on it. I just don't have that understanding today. But it's a good question. I will follow up with my park staff, and Molly will be back in contact with you, Paul, and give you an update in terms of where we're at. But I would like to move ahead with passive use. I think it's important. We certainly have individuals within our community that for certain physical limitations or other things can't engage in the constant movement, and we don't want to restrict their access to our beaches. We would like it available to all members of our community. So I'll have that conversation. If we can do that safely within what's allowed, you'll see us take those next steps.
Our next question comes from the line of Ian Wheeler from the Orange County Register. Please go ahead.
Thank you. I probably either Dr. Quick or Dr. Chow could answer this, but I have questions on the recovery data provided starting Tuesday this week, and kind of in two parts. I'm hoping for an explanation of the epidemiological benefits of estimating recovery data as it's been done, and an explanation a bit about the 28-day case count window that's being used as opposed to another window of days and case counts. The second part is that there had been pressure by the Board of Supervisors to provide recovery figures. So I'm wondering if the board hadn't asked for them, would the healthcare agency have released these estimates?
I think the answer is yes to both of those. I know that our board members have asked for recovery data. Certainly our chairwoman has asked that on numerous occasions. I have asked the same as well from our healthcare staff. I think their concern always is that when you're showing data on the website, if it is not 100% accurate and you're using estimates to provide information, I think there's always a concern that there will be members of the public that review that and they want to challenge that data. And we thought that during a time when we're in crisis, having the most accurate data, ones that we can stand behind, were very important to public messaging. But as time went on, absolutely, I think it was critical for us to show that this COVID infection for many portions, a significant portion of our population, was not having as significant an impact. And our ability to show that most individuals recover and recover well from COVID, we think that that also is an important message to share. So it's really balancing those two things. And what our healthcare agency did was they followed up with other counties that were providing recovery data. And we spoke to them and said, number one, how are you calculating it? and we looked at all of their methodologies, and we tried to put one together that got as close to being as accurate and representative of what we are seeing within our Orange County COVID population. So Dr. Chow had to move away because he's doing that business recovery retail seminar at 3:30, so he did have to step away. But what I'll do is I'll make sure that your questions related to the epidemiological basis, others, are responded to by our PIO. Molly has your information, and she'll be in contact with you later today, Ian. Thank you for that question.
Our next question comes from the line of Spencer Custodio from the Voice of OC. Please go ahead.
Hi, thanks for taking our question. This one, I guess, is for CEO Frank Kim. The OC is Sheriff. I know he's not there, Don Barnes, but Sheriff Don Barnes had indicated that, hey, we're not the mask police, and then he also indicated that his deputies will enforce through education, kind of like how they did the Gavin Newsom stay-home orders earlier on. But he also said that he wouldn't be enforcing the limitations on church gatherings, the large congregations. And I'm wondering if Frank, of your office or anybody at the county has been able to work with them on some kind of way to approach the state limitations on the gatherings, and if there's also any more clarification on the mask issue.
I'm happy to address that. Number one, you have to, I think, first understand that Sheriff Barnes is local law enforcement for a certain portion of the county. He does not have direct law enforcement responsibility in cities that have their own police department. So I don't think it would be fair to say that he's got this responsibility across the entire county. I think he made it very clear that he would find it very difficult to enforce a mask ordinance or go into a church and enforce the limitations on the number of members of the congregation that are participating in a church service. And I think it's really not appropriate for me to speak for him, but I think from a county administrator perspective, I think what I believe that he is sharing with the community is that, number one, our job within the county is to provide information, to provide guidance, and the best information that we have to help people maintain the appropriate safeguards so that this COVID infection does not spread more widely than what we can help to prevent. And I think the challenge in that is that we're getting direction from the state, and sometimes that direction changes from week to week or from day to day. And then there's a requirement for the healthcare agency to then respond. And then it gets further complicated because our health officer, her authority derives from the state health officer, who is an agent of the state. So then we get into multi-jurisdictional guidance. And I think we have really endeavored to make Orange County residents understand the best practices in reducing the spread of COVID. So if that means that we are issuing a health order on face coverings, if that we are asking individuals to maintain the strict requirements that we receive from the state in terms of the number of gatherings within a church service or a private meal at a home, those are things that we're sharing with you. But I don't think that there's any intent for us to go out and station a law enforcement official, whether it's in an incorporated city or if it's a city patrolled by the sheriff's office, to do a count or to enforce certain mask requirements. That is not what I believe law enforcement will do. But I think it's really important, and I hope this message is not lost. It's really important for the residents of Orange County to understand that health orders that come out of our local health official, that is her medical opinion about what is best for Orange County residents to limit the spread of COVID. And I understand that there are different opinions in terms of whether individuals want to follow that or they believe that it is healthful or not. But I think we all need to understand this issue of COVID is relatively new. The medical science sometimes is different depending upon the article or the journal or study that you read. So a lot of it is based upon, I think, common sense. It is evolving from week to week, and I would hope that individuals understand that as we give order or guidance or strong recommendations, they're coming from an honest place of understanding and trying to digest all of the new information that is available and trying to provide the best guidance, or in some cases, an order for Orange County residents. And I hope that that is how, that's the spirit in which our Orange County residents receive that message. We are not out to have strict enforcement. We're not out to cite individuals. We are not out to station deputies or police officers in your community. That is not what we're doing. We're out here to communicate with you, to give you information, to encourage you to be as safe as possible. And I think in that message, I speak for myself and the other officials within the County of Orange. Next question, please.
Our next question comes from the line of Margaret Carrero from KNX. Please go ahead.
Hi there, CEO Kim. Hoping if you could specify a little bit more and kind of clarify what that face covering order means. Sorry, it's so loud. And also, any indication at this point that some of these new cases that we're seeing linked back to any protests or people being back out more, out at the beaches, more community transmission? I know we've had a lot of them in the skilled nursing facilities, but any link to community transmission in the new cases?
No, we don't have any evidence to suggest that the rise in cases has anything to do with those individuals that were participating in protests or those individuals that were out enjoying the wonderful beaches in Orange County. What we know is that we did have a strong spike in terms of infections that occurred within our skilled nursing facilities. We did have an outbreak that occurred within a homeless shelter environment. So a lot of what we're seeing is directly associated with that. And our health officials also identified that we are seeing a rise in community transmission. So I think that is the concern we have, is that as we reopen Orange County, which is fantastic, and I can't thank our healthcare staff enough for the work that they did day and night to complete that attestation. Dr. Quick and her team, they worked 4 or 5 days straight, late into the evenings, to accomplish that for our Orange County residents and businesses. So I don't want it to be lost that we don't appreciate what they did, but as that happens and we reopen our economy, I think that we all acknowledge that we will be interacting more with one another. And with that comes the additional risk of potential virus transmission. And I think that is the reason for the health order, to reduce the potential spread of that viral transmission. In terms of what does it mean, I think the most common sense way for me to explain that to most residents is to say this. If you are out of your home and you're interacting with either a business or at your workplace, or you're in a public space, and you cannot maintain your 6 feet of social distancing, the order requires you to put on mask. That's really what it is to say that if you can't maintain that 6 feet of social distancing, it requires you to use a mask. Next question, please.
Our next question comes from the line of Tony Cabrera from ABC7. Please go ahead.
On that note of the spike in the daily death counts related to skilled nursing homes in Orange County, has the state expressed any concern over last week's spike? Are they keeping an eye on any trends that might be coming? And, has there been any communication in regards to last week's spike?
There has. In fact, I know our healthcare agency had gone out several weeks earlier, and they had provided training to the skilled nursing facilities in terms of how to manage COVID. We had also provided additional PPE support for skilled nursing facilities. We have also worked with them to enhance their testing program. We know that the state has set up their own committee or group that is overseeing skilled nursing facilities, and they're directly engaged. I believe that they are in contact with them regularly to understand what is their capacity, how many individuals do they have, what is their testing protocol, et cetera. So our understanding is the state is working very closely with them, as is our public health staff. Next question, please.
Our next question comes from the line of Alicia Robinson with the Orange County Register. Please go ahead. One moment.
There's a little bit of overlap. apologies if there's some overlap with some questions that have already been asked, but Dr. Chow told the board on Tuesday that the May 22nd health order regarding masks could potentially be sort of misunderstood, and that he anticipated it would be clarified. So is the health order being revised in some way? If so, when might those revisions be made public? And
Yes.
will those revisions include returning to just a recommendation for the general public to wear masks as opposed to a requirement?
Sure. Thank you for that question. My understanding is they're working on a revised health order. The reason why they're revising the health order is that the state this week made an amendment to what was allowed under the phase 2 for the variance counties, and that's where they allowed the barber shops and hair salons and the religious ceremonies to occur, churches to reopen, etc. And in our original health order, we were very specific about which businesses and industries were allowed to open under the variance attestation. But now that the state has made a modification, I think what you'll see is we'll revise our health order and simply point to the state website and say that with our attestation, the governor has allowed additional businesses and industries to operate within Orange County. Please refer to the state website for the listing of those businesses. We're doing that because the governor had advanced or accelerated some elements that were in stage 3, and he moved those into stage 2. And what we don't want to do is keep issuing new health orders every several days. So since we don't know exactly what the state will do in terms of further loosening those stay-at-home orders, we think it's easier for us simply to point to the state website and indicate that the industries that are permitted by the state to operate are permitted by Orange County to operate. Our goal is not to be more restrictive in terms of those industries that operate within our county. But I can share with you that I don't believe that our health officer is planning to amend the health order on face masks at this time.
Our next question comes from the line of Martin Wiskel with the Orange County Register. Please go ahead.
Thank you. In the past at nursing homes in Orange County, if 2 or more residents tested positive, HCA called for tests of all patients in that facility and offered voluntary tests to staff. In light of the state public health department's May 22nd letter from skilled nursing facilities calling for all residents and staff in all skilled nursing facilities to be tested, has the county changed its protocol for nursing homes in the county?
We're following the state protocol. So as the state revises their protocol, you will see the county absolutely align itself to that in terms of testing. We do know that facilities like skilled nursing facilities, jails, homeless shelters, we have group homes for children. Those kinds of programs where it really is a congregate living environment are the highest of risk, and that is why the county several weeks ago put a contract in place to have a mobile testing unit that goes out and visits these facilities regularly to provide testing programs and services. So that is some of what the benefit is of having the CARES Act funding that came down from the federal government. We're using those dollars to provide this mobile testing platform. So we're very excited about that, and we're hoping that that addresses and hopefully bends the curve in terms of infections that may arise within these congregate living environments, including skilled nursing facilities.
Our next question comes from the line of Vernon Nelson with the Orange Juice blog. Please go ahead. One moment. Question comes from the line of Norberto Santana with the Voice of OC. Please go ahead. Norberto Santana, your line is open. And once again, Norberto Santana, your line is open. You may be on mute.
Yes, thanks for that. Appreciate, Frank, you taking questions. Can you go a little bit into... can you go a little bit into the blowback that came to health officials from the Board of Supervisors earlier this week about the mask order? And can you talk a little bit about the difference or the powers of the public health director under state law and how you guys are juggling those different jurisdictions? You mentioned it a little bit earlier, but I'm particularly curious about Dr. Quick's authority under the law, and also curious to hear about her safety and whether anything extra is being done to make sure that she's okay.
Well, number one, I can assure you that we're taking all actions to ensure the safety of our employees. That is a paramount action, and we're absolutely addressing that. I'd rather not get into specifics about our protocol. I don't think that's appropriate, but I can assure you that we're taking every available action necessary. So she is safe. Number two, I'm not an attorney, so please understand that as I explain my understanding of her authority, it derives from my understanding that she is the county's health official. She is an official with her own statutory authority, and it's granted to her and derived from the state of California. So she takes that guidance from the state health official, and that is her authority in terms of how that is implemented within our local jurisdiction. So Dr. Quick has her authority to issue health orders and to take actions necessary to safeguard the health of Orange County residents from communicable diseases. That is one of her many duties. And in the discharge of those duties, my understanding is that she does have authority and cannot be superseded by our local board. Now, that being said, we certainly do respect the role of the board because our Board of Supervisors governs Orange County, and we all work for the board, at least those that are not elected countywide. So all of the employees that work for the board, we maintain very good working relationship. There are absolutely times when the board members, or one or two, or sometimes a majority of board members may not agree with the actions of either the CEO or a county health officer. And I think when that occurs, you see those disagreements occur in a public forum because we have a Brown Act. So when we talk about policy issues or issues that board members want to discuss amongst themselves with their colleagues to see if they have, I would say, a consensus or information that together they want to share with our health officer or to the CEO, those are the discussions that you see occur at our board meeting. So I think that is normal. Sometimes it is uncomfortable to hear disagreements, but I think that is government at work. And that is why we have a Brown Act, and I see nothing wrong with a healthy discussion. And I think it is normal for 5 board members to not always agree with everything that a CEO does or a health official does in terms of the performance of their duties. And I think that's what occurred. I think the board did an outstanding job of supporting Dr. Quick in terms of all of the actions that she has taken to date. I know that this mask order, there are disagreements within the public as to their desire to either see it enforced or not enforced. I can tell you that in my office, we receive calls from and emails from individuals that absolutely support it, as well as calls and emails from those that do not support it. So I do understand that it is a policy issue that has champions and opponents on both sides of the issue. But our health officer has issued an order. My understanding it is not likely to change in the immediate future. She has indicated to me that she would like to see, right, what is happening with our case count, what is happening with the virus transmission over the next several weeks as we reopen our economy. And I know that she is open to reevaluating that if the data suggests that other actions may be necessary. So I think she's open to it. She's not planning to change it. And I think what you experienced or heard or viewed with our board meeting that is the beauty of the way that our government functions. It's wide out in the open, it's transparent, and you can see the agreements and disagreements both at the same time. So thank you for that question.
And our last question comes from the line of Nick Gerda from the Voice of OC. Please go ahead.
Hi, Frank. I had two quick follow-ups. One on the health officer orders. I believe those are reviewed by county council before they go out to determine whether they're legally compliant with court rulings, et cetera. Is that the case with this mask order? And then secondly, on the homeless shelter outbreak, I was wondering which shelter had an outbreak, how many people were infected, and how they are now doing.
Yeah, so on the health orders, all health orders are reviewed and by county council, and they assist us by obviously doing a legal review and also helping us prepare the document itself. So this order was reviewed, as have been all other health orders. The shelter outbreak, we've had 2 so far, one in Anaheim and one in Fullerton. I don't have the specific numbers in terms of infected individuals. I believe that you can contact the healthcare agency. Their PIO can provide that to you, or Molly will. So thank you for all your questions. We appreciate all the feedback and input from the media. We'll see you again next week. Thank you.